There you are. Happy Friday. Wonderful to have you on with us today. We're going to talk about something really important, speech therapy for Parkinson's patients. And then we've got some Western music coming up, Western holiday music too, because it's the Acre Musical Showcase. So that's what we're going to talk about and do today. You know, it is the holiday season and it's so fun. This truly is my favorite time of year, and people are so nice this time of year. I love it, and I love the music and the lights and, you know, the whole thing. But I have to tell you something funny. You know, this could be all year because I was on survival years and years ago. For 30 days, we hiked 300 miles, starved, froze. I've told you about this before, but we decided to have Christmas in the middle of this thing. And so we just decided it was Christmas, and we sang songs around the campfire, holiday songs, and we made little crazy gifts for each other, you know, out of berries and seeds and rocks and things you could find on survival. And you know what's weird? It felt like Christmas. It truly did. So, hey, I'm saying fake it until you make it. And you can do that all year too. So, happy holidays. Now, I want to talk about that Parkinson's thing because so many people have this, and speech therapy is a really important part of it. So, Kelly Smith is with us, and you are a speech language pathologist. Great to have you on, Kelly.
Thank you for having me.
This is so fascinating. My grandfather had Parkinson's for, I don't know, 30 years. It was a long time. And so tell us a little bit about Parkinson's. What is it exactly? What's it affect?
So Parkinson's is a chronic and progressive neurological disorder, so it just worsens over time, and it has to do with the messages that the brain sends to the body about the movement and coordination. So it can impact walking, talking, swallowing, all your motor movements.
And I tell you, it's the oddest thing. You know, when something hits you, it's either one thing or your body is really healthy and you lose your mind, or you know, your mind stays really sharp and your body falls apart. And in the case of my grandfather, that was it. I mean, he was our memory person, would say. So, you know, remember this, what about this? And he would remember all that. But it was, as you say, you know, being able to walk and being able to speak, because it would be really hard for him to talk. Why is that? How does that, you know, what the symptoms of that? Tell us a little bit about
So there's motor symptoms that are affected because it's all about the movement and coordination of the muscles. So a lot of times we see, you know, changes with your walking, in coordination, instability. We see changes with swallowing because it's all those muscles that need to be working right. Changes in your speech, not being able to articulate your words clearly. And then sometimes the cognitive deficits like you mentioned.
Yeah, which is so frustrating. I know not every Parkinson's patient has, you know, real strong cognitive like my grandpa did, but nevertheless it's there. So, you know, you don't realize the impact of not being able to speak well. I think my stepfather had a stroke, and same thing, he had a really hard time speaking. He would get so frustrated. He would just say, never mind.
Yeah.
But so what do you do with Parkinson's patients? How do you help them with these motor skills, with the swallowing, with the speaking, Kelly?
So if you've been diagnosed with Parkinson's, you know, 90% of people with Parkinson's disease complain of speech changes or voice changes. So the most important thing is getting in for speech therapy just to get started and learn some strategies. There's a really well evidence-based program and research program called LSVT. It's the Lee Silverman Voice Treatment, and it's a really intensive therapy program that we provide at Mountain Valley to help with speech, help with voice, and help with swallowing as well. It's all about improving the loudness of your voice and the quality of your voice and just helping people communicate on a day-to-day basis.
It is, the Mountain Valley Regional Rehabilitation Hospital is an amazing place. I was over there on the zero-G machine not too long ago. But you have a wonderful facility, and it handles all kinds of physical therapy. But this is a really interesting one. I guess I didn't realize that you would do speech therapy over there.
Yeah, so speech therapy, it's a little misleading term. We don't just do speech, but also swallowing therapy and language therapy and then cognitive therapy as well. So
that's wonderful. Now, how do you start, where do you start with the speech therapy, and what are the options in terms of helping people to be able to speak better?
So if you're recognizing any of the symptoms, it's important to get in with your neurologist first or talk to your primary care physician. From there, they can refer you for a speech evaluation or a physical therapy evaluation. Once you can get into the facility for an evaluation, we can determine if you need more treatment or refer you to another discipline if you're needing more for the walking or more for the talking, depending on what we see. But it's important to just get in for the evaluation first.
Now, when they have speech therapy, does this like relax their throat, or what does it do with or does it coordinating with the brain in a different way to try to help them to speak clearer and louder?
Yeah, so it's just a really intensive program that works on lots of repetitions to help the brain perceive your voice as being louder. A lot of times with Parkinson's, the voice just gets quieter and quieter, and they think everyone else needs the hearing aid. And we just have to kind of work on retraining the brain of what a good loud voice is and what the best quality is.
So even with Parkinson's, the brain can learn.
Yes.
Still,
yes.
It can change. Wow, I know, because that's so hard. And then it seemed like there's a halting, like it's hard to get, almost like with stutters, it's hard to get the voice to work. Can you remessage the brain on that
Yeah,
too?
it just takes training and lots of repetitive practice. But there's
really
lots of
does.
treatment options out there for Parkinson's specifically and other neurological disorders as well. But it's just about retraining and teaching them strategies to help them improve.
So it's really not, of course, I know that there are still drug therapies that Parkinson's patients to replace that dopamine and that kind of thing. So there's that. But in terms of this part of it, it doesn't really, that's not what it's all about then with the
No,
therapy.
I mean, therapy is a great conjunction with the medication. But a lot of people that are diagnosed don't get treated. They don't come in for therapy. So it's just important to know to get in and get the evaluation done.
And I think that's it, because I can tell you, of course, it's been a long time ago too, but I had no idea that it could be improved or changed or helped with therapy. So that's an amazing gift to have around the community. So again, Mountain Valley Regional Rehabilitation Hospital in Prescott Valley, Kelly Smith, speech language pathologist. Thanks for joining us. Very enlightening.
Thank you. Appreciate it.
Oh, fascinating. All right, don't go away. We're going to have some wonderful Western music coming on live. We'll be back.